Hi, my name is Evelyn Castle, and welcome to our very first episode of the EHA Founders Series, where myself and my co-founder, Adam Thompson, talk about our experience founding our companies, some lessons learned, and challenges that we had along the way. On today's episode, we talk about the actual founding of eHealth Africa, which is the very first company that Adam and I founded together, and how we became business partners. For those of you who don't know, eHealth Africa is a public health nonprofit organization based in Nigeria. And if you want to find out more about eHealth Africa, I will put the link to the website in the description below. So I hope you all enjoy our very first episode. Alrighty, so today is our first time that we're doing this. And again, the purpose of these is to kind of document the history of EHA and just talk about our experience so far and why we're doing what we're doing. So the conversation that we're having today is about basically just kind of how we started EHA and mostly just focusing on that kind of first summer that we came to Nigeria. Then when we went back to Santa Cruz and kind of what led us up to really, committing to this and moving full time to Nigeria. Although at the time we didn't know it was going to be a full-time experience. Right. So I wanted to ask, do you want to say what your official story is of how EHA started? Like when people ask you, what do you say? What's your official story?
Well, I think the official story, the way that EHA started, originally was based out of a research project or, an idea that you could use electronic systems, data systems, electronic healthcare records to improve how data was managed at healthcare clinics in Nigeria, with the idea that that would be taken up by groups that funded public health programs, by governments, by whatever it was. And, that was the initial kind of start. And I think that that first summer where we saw that in practice, we saw that there was a lot of potential for it. So on returning, we focused on kind of like fundraising for future activities or fundraising for future work. I don't remember when it occurred to us to kind of like register as an organization.
I find it just really funny that you're saying this because that's not the official story that you normally tell when people ask how EHA started. That I actually think is more close to the real story. But I feel like the official story that both of us generally end up saying is like, we were researching at the University of California, Santa Cruz, and we got tired of researching and we wanted to go and try to put some of these research methods into action in Nigeria.
Well, I think it was like it became clear that it wasn't going to work as a university project because I think early on, I thought that this would just be something that we could keep fundraising for, use the kind of university as like a backing and keep doing. But then it just became clear because when you raise funds at the university, and we were operating on tiny budgets, and if you have to give 30%, 50% overhead to the university, it makes a lot of those projects not really work. There was kind of and again, I don't remember when it was, but there was definitely a time where it was like, this isn't going to work at the university or as a university project.
Yeah.
Because one, you wouldn't be able to focus on it because the work at the university, is running 10, 12 projects at a time. And so this would have just been one of them. Yeah. So I think that, anyway, that idea and realizing that there's some legs to this, but we weren't sure that there was kind of enough to really kind of keep the university as a partner in expanding that and didn't really have the support anyway to do that.
Yeah. Well, we'll come back to that a little bit later because I think that we didn't necessarily know that until when we came back from Nigeria the first time. So I think it would just be kind of funny to talk, though, about like when we first went to Nigeria, why we went, because the first time that we went to Nigeria, the idea wasn't even really that you and I were going to be working together. And as I was writing these questions yesterday, I thought it was kind of funny because I'm actually asking you these questions because a lot of them I don't remember. So I'm curious if you remember. But I know I went to Nigeria originally because I got some research funding to basically research about like using eHealth tools in Nigeria in maternal and child health, but it was very specifically eHealth and like mobile health. And that was kind of like the new thing. I remember I just got one of the new phones that had GPS on it. It wasn't a smartphone, those weren't out yet. And I know I got paired up to work at this health facility or whatever, PHC in Kaduna. So I know getting on the plane, that's why I was going. And so getting on the plane, what were you technically doing?
So at the time, we had kind of funding for a range of projects. So the partnership with the clinic and with Mayor Mandra was one of, I think, 3 projects that was happening at the time, or maybe even 4. The rest were looking at how different civil society groups were using technology and how some of those things could be improved. So yeah, and it was a couple of different organizations that all were involved in kind of both getting better use of technology for civil society groups, but also kind of seeing how technology could also then, empower the communities that they're working in by getting people access to resources online or, getting basic computer literacy for different groups. Yeah, so I forget the exact names of the different research projects, but they all kind of bordered around that general idea around civil society and community organizing related to technology in northern Nigeria.
But what were you doing specifically? Like, what were you there to do? Collect information?
My job, yeah. So, my job supported like the implementation of it. So there was some training institutes that were being run at CTAD, which is the Center for Information Technology and Development. And my job was to coordinate them and set them up. But then, and then also like work with those different civil society groups and kind of figure out what the needs were and what were kind of like potential other projects. And we had an institute that was supported by the MacArthur Foundation on, I don't remember what the groups were, but like it had to do with like women's cooperatives or women's organizing or something like that. But there was a couple of them. So I mostly did the curriculum development, the coordination, and then hosted a lot of meetings with the different groups.
Okay. And then do you remember how long was it between then kind of like getting to Nigeria and the conversations that we started around the clinic? Because I remember very clearly kind of realizing that like eHealth technology wasn't really what was going to work. I remember we had originally beforehand talked about setting up like frontline SMS. And I think we even had tried to set up some systems around that. But I think fairly quickly we realized that, or when I was in the clinic, I realized that, the mobile health stuff probably wasn't super helpful.
Yeah.
And maybe more something on a laptop would be more realistic in that frame. So one is, do you remember how quickly we kind of started working much more closely together? And then I also don't remember ever necessarily talking about OpenMRS before we went to Nigeria. Do you remember how we came across OpenMRS? Maybe you knew about it beforehand?
Yeah, OpenMRS had come up in some of the different groups, like the technology groups that I was part of.
Yeah.
But yeah, I remember those conversations where, after your first week or maybe a bit more there, of kind of observation and kind of needs assessment, if that's the right frame for it. But realize that, like an SMS-based system wasn't going to be terribly useful in both the reporting and recording, because really what it was, like their biggest need that they expressed was just recording and tracking women through kind of antenatal to birth. And then after that, the vaccinations of the children. And there just wasn't going to be a real practical way to do that with an SMS or phone-based system. So I remember proposing or discussing OpenMRS, and then I think you ended up diving in and doing a lot of the research around, how do we get it up and running and how do we customize the forms and doing those kinds of things. But it's weird because I feel like we came with some equipment that I don't remember buying there, but maybe we did.
No, I remember we bought it because we bought it from Abdul Hamid.
Yes, the Invenio stuff.
Yeah, which was really funny. But remember, I think we had enough money to buy one computer. And then remember we went to the Shehu Idris College and the McCarthy, was it McCarthy?
Yeah.
Yeah, gave us the money to buy the second one.
Yes.
Or they bought it for us or whatever it was, which was pretty cool on its own. I mean, when you think about like how difficult some of this stuff is to get funding released.
Right.
Okay, so to kind of finalize that summer, I mean, like we set up OpenMRS. It was mostly being used for the immunization services. I remember after we kind of got it set up for the immunization, just kind of like tracking immunization records, and they needed it mostly for reporting. They wanted to know really quickly like how many people they had vaccinated or how many children and what vaccinations they had got. I know that we started looking into like digitizing the antenatal forms and then also trying to start using it for decision support. So, if a woman has X, then like the next, I don't even think it was so much decision support. It was basically just helping them fill out their forms. Like if she has one thing, you can't say she has like something else, things like that. Or you need to also enter this other piece of information. But I think that we kind of like tested it out a little bit, but we never really fully implemented it. I think the major success that we could talk about was more the reporting for immunizations.
Yeah, and just beyond reporting, I think that there was the reporting side, but it was just having the records, like, because I think that was always a big challenge, is like a woman would come in, and it was, unless you were dug through all the paperwork, you wouldn't know if it was her second visit, third visit, fourth visit. And the idea was that they were trying to track through, make sure women got 4 antenatal visits. And then they had some information from those visits. But like when they were doing it before, it was just like each visit like started anew. So if the woman was there her 4th time, they had no idea about her previous anything. And then the same thing with the children, right? Like being able to track like just what dose are we talking, like what vaccine are they on? And I think those things helped a lot, because then they're there. And then like you said with the reporting, to see if they were actually like meeting targets. And
yeah. Do you have any other like memories about being at the clinic? I don't remember how many times you actually went yourself.
I do. I mean, I remember like sitting with the matron a lot.
Yeah.
And also that kind of records room that was taken over with the computers. Yeah, that's all I remember.
Yeah. I mean, which makes sense. I think that when you were coming to Kaduna, I think we spent a lot of time actually working from the house with the technology side of things, because the clinic didn't always have power, and so it was easier for us to work from the house. But again, it is kind of funny because, and I really don't know how we did it, we were able to do so much of that offline, because at the time you couldn't hotspot your phones, you couldn't do any of those types of things. So
yeah, we had to have a full, like we set up the laptops to have like a full OpenMRS server running on the laptop. That's why we could do the form development.
Yeah, so that was kind of cool, because I remember when at that same time I was helping Girl Child Concerns just do their website, and I remember in the evenings I would go to that internet cafe that was kind of close by to my house, and I would spend hours trying to do like one thing on WordPress, and it was painful. So there was no way that we were going to do anything really online for OpenMRS. But yeah. Okay, so then that's kind of like the work side of that first summer. But then obviously we had the kind of like just getting to know Nigeria side. I mean, obviously you had been to Nigeria before and knew Nigeria, but it was my first time. Do you have any like really vivid memories of crazy stuff that happened that summer?
That summer, I mean, there's lots of different things. I mean, I spent more time on the Kano side, and I know that there was a whole group of like student interns there, and I think they were all VSOs. And so I remember spending a lot of time with this group of people from the UK. I remember one time we tried to go to Tiga Dam, but we took like a local bus because we didn't have any transport. And then, got to Tiga and then ended up having to walk like 3 miles to get to the dam, like in the middle of nowhere. And then, we had that big horse riding experience.
Yeah, when we first
got
there.
wasn't the first summer.
Yeah, that was.
That was the first summer.
That was the first summer, yeah.
Where we met Abdul Jabbar, and he took us through the old city, and we went, like, had a big horse riding parade.
Yeah, that was exciting.
Through the old city.
And did you see the pictures that I found from that? Yeah. And it's funny because, like, for looking back, it's like I must have spent a lot of time by myself, but, a lot of the vivid memories that I have are kind of with you, because probably, I didn't necessarily go out and do anything really stupid by myself in Kaduna.
Yeah.
So I remember both in Kaduna and Kano, like, it's interesting looking back about how safe both of those states were at that time. We could walk around at night, at like midnight, walking, from the club back to where we were staying. Okadas were still a thing back then. I remember us doing, 2 to an Okada at night, which obviously was really stupid. Yeah. And then obviously I remember the place that you stayed behind the Indian restaurant, which was actually a fairly decent place to stay. Yeah. And then obviously great food at that place.
Yeah. Yeah. There were a lot of things like, like that where, we just, either it was not safe and we were ignorant, or it was actually just a bit safer. And when you just didn't, you didn't worry so much. Like the climate really changed later on. But yeah, the rugby club, the civil service club, the place with the fish next to the rugby club.
Yeah.
Where else did we go in Kaduna?
Yeah, I think the only places that I really remember in Kaduna were the fish spot and the rugby club.
I think once or twice we might have went to that Air Force Club place like late at night.
You're right. I don't really remember who our friends were back then, though. Like the people that kind of ended up taking us. It must have been just people that we met at the rugby club would be my guess.
I think so, yeah.
But the other thing that I really remember about that trip was that when we were on the plane, that Michael Jackson died as we were flying over. And then when we landed, and that entire summer, it was just 100% Michael Jackson everything. Yeah. Like you'd be walking in the market, it'd be Michael Jackson. You go to the club, it would be Michael Jackson. You'd listen to the news, it was Michael Jackson.
Yeah. When I remember, there was one night that it was like one of the first couple of nights that we kind of, went to the rugby club, and we weren't members there. And so we kind of, like, each time we kind of had to like talk our way in. Yeah. Or someone would pass us, they would invite us in.
Yeah.
But there was, it was like a really weird place, because there was one point where everyone was just dancing to Michael Jackson at night. And it was like an old Italian couple like a couple like retired colonels like in the military, and like just just kind of a weird, a very weird environment that you're just like, what is this place, and like how is this happening?
Well, it was Michael Jackson or P Squared. Those were like the only two things that like they ever listened to.
Yeah.
So yeah, I mean, the only other kind of like really vivid memories that I have was like all of the time that I spent with the ambulance driver. You remember Shehu?
Mm-hmm.
And he'd pick me up every day.
Yeah.
And do you remember that trip that we took where he drove us to the university in McCarthy? Yeah. And then remember the ambulance broke down?
Yes.
And we had to take that bus back.
Yeah, student bus,
yeah. But for whatever reason, we had to go through that village first. And then all the kids came out and were like banging on the car and shouting at us.
Yeah.
And then the other like really vivid memory that I have about that summer was actually my trip home, because I took local transport up to Kano to catch the flight. And remember the old Kano airport, there was nothing there. It was basically just like a hall. Yeah. And do you remember that guy? I forget what his university was or whatever, but he was like really aggressive and he like wanted to give all the women presents.
Yeah, he was one of the civil society groups that we worked with one of the Packard Health Fellows. I forgot that's the other thing I was doing, is the Reproductive Health Leaders Network.
Yeah.
So, but yeah, he was one of them.
Yeah. And I remember because like for whatever reason I had to go see him, but wouldn't let me go by myself.
Yeah.
And so
it's like the Center for Human Rights in Islam or something.
Yeah, exactly. Like yeah. And then he basically bullied him into like getting me food because he wanted to escort me to the airport or whatever. And so I was like, why aren't you bringing her food? And so we all went and like they sat with me while I waited for the plane. And then it was actually really great Nigerian food that obviously like his wife or something made and like the takeaway, not even like the homemade warmer thingies. Yeah. So it was really nice. Yeah, it was great.
Yeah, those were back in the days when KLM flew straight into Kano. That's crazy.
Yeah, I guess it was KLM. I remember the other thing I really remember is buying that plane ticket. At the time I didn't really know you very well when that first trip. And because we were on such a tight budget, I was like on your case about like the dates and like which flight and everything, because I was trying to get the cheapest possible ticket.
Yeah.
And I remember like calling like multiple travel agencies to try to like sort everything out. Yeah. And I think you got your ticket for like around $1,200 or something. And I ended up getting my ticket. Like I specifically remember this. It was like $950. Yeah. And I remember you just being like, how did you do that? Yeah. And it's like, I harassed so many people to try to get that ticket.
I thought it was cheaper than I thought it was like $800. And I remember specifically thinking like, oh shit, she bought a fake ticket.
Yeah.
From some like shady website.
Yeah.
But it worked.
Any other things from that summer to highlight?
That was also, I mean, even though I'd been to Kano a couple of times before that, like I think that was the first time I met Jihad, I think. Yeah. Yeah. Because that was the connection we had to, speaking, planning for the following year.
Yeah.
I met him at the
Motor Club.
No, I actually met him at the Lebanon Club. Like one of the times because remember Paul came by, came in for like a week or two.
Yeah.
And we'd gone there and we ran into Jihad and, all started chatting and then connected with him a few more times and then like made plans for the following summer.
Yeah, that worked out really well. Okay, so then, we finished that summer and we get back. Do you remember like what was it that we left that summer on that we were just like so motivated? Because I know we even came up with the name and everything, eHealth Nigeria, when we got back. And the plan was always to go back. At that point, we had already started getting recognition from like the OpenMRS community, right? And that was kind of one of the reasons that we got so excited about the work that we were doing. Yeah. Do you remember anything else of like why we were so excited to kind of like do this and to go back, other than I guess just the experience itself?
Yeah, I mean, I think it was just because there was an opportunity because because the OpenMRS, I think I think what we learned is like OpenMRS was great, but it was much harder to set up than I think people made it out to be, and having that experience and being able to work in northern Nigeria to get those things up and running, I think was quite unique. And there was a lot of interest. There was more students that wanted to be involved, like at the university. And there was kind of like a level of excitement there. And and part of the goal, right? I mean, part of those classes at the university was around social enterprise. So it wasn't, it was about how do you turn this into a business or a business-like model. Yeah. And so I think that was just like kind of running with that. And that was like one of the more like concrete activities that kind of made sense in that kind of social enterprise style of work.
So I went back and I found, that, and I realized like obviously during that year we were doing a lot of fundraising. So I had tailored some of my proposals to kind of what the fundraising was for.
Mm-hmm.
But one of the ones that I had looked back on was the business plan competition that we did.
Mm-hmm.
And, it was funny because I kind of forgot about this, but I do remember, like, I think our original goal was really that we were going to create like this instant EMR that we called it, remember?
Mm-hmm.
And like, I just pulled out a excerpt from that business plan, but it's the instant EMR is a low cost, easy to deploy, and proven to be effective at providing accurate real-time healthcare information. And then I forgot about this too. So for example, researchers at UCSF working with international agencies have developed the anti-shock garment to prevent blood loss during childbirth. The project is costing in the millions of dollars, and our instant EMR in northern Nigeria is the only system collecting info on its use and effectiveness. Our solution with the instant EMR will help researchers and international agencies prove the effectiveness of their health programs, which in turn lead to millions more invested by the NGO community and businesses in health service. Which I think like actually is kind of funny because like obviously that's not really what we started doing, but I almost feel like in some ways we're kind of like coming back to that model of like the business plan side of things.
Yeah, I remember specifically that because, this was after we were still kind of in the post-2008 economic collapse.
Mm-hmm.
And groups like one of the things the year before in Nigeria was with the Packard Foundation because they lost so much of their endowment during the crash. They're actually pulling out of Nigeria. And so part of it was like looking at like who they can basically hand over their grantees to. And it was MacArthur and Gates Foundation at the time and what support they needed in that transition. And, we kind of hypothesized that like, well, they were spending a lot of money in these kind of healthcare areas, but they would get data or they would get reports, months, years after the fact. And so it was no longer, they were never ever looking at information as it was happening. They were looking at historical information, and it was never very good in the first place because if you get a report 1 year and you realize things didn't go well, and you make some adjustments and you still don't see what happened for another year. And so there just wasn't a motivation to keep some of those programs going and this in place. They, wouldn't be those long gaps. They donors themselves would be more motivated because they would see day to day what impact was. And if there was a problem, they'd see it. And then they could make those adjustments more like real time as opposed to on these 1, 2, 3 year funding cycles.
Yeah.
And we thought that if the clinics couldn't pay for that themselves, this would be something the donors would be willing to pay because they would just get that information.
Which I still feel like is a very legitimate business model.
Yeah, exactly.
But I mean, also we found that, NGOs don't necessarily want to pay for this, but the idea in general still makes sense.
Well, a lot of groups did. I mean, I think that we didn't have it's one of those things like, I think if we took the real business model approach, we would have we raised money to actually go do it. Whereas most people would have raised money to market it and then go do it.
Yeah.
And it's kind of one of those things we could have spent a year instead of going back to Nigeria to try more. We could have taken that money and just went around to the NGO circuit and, visit all those. And we probably would have, at the end of the day, raised more money.
That's true.
But that just wasn't something we knew about and were very experienced with or wanted to do. I mean, I think we wanted to see it in practice. And, we thought in practice was where the money is. And obviously we know that's not the case in the NGO world. It's much more in the marketing and the communications and
Yeah. Well, I also think the other fatal flaw with that was that we thought we were going to customize OpenMRS to be this kind of great EMR system, which, I remember spending months cutting forms out and trying to figure out how to make some of these forms make sense, which just never ended up being possible. And, again, if we were to redo it now, we would just go with a software that someone has already made, and just look at marketing that to Nigerian clinics or something.
I think it's still strangely difficult because there are all of these clinic EMR softwares and they're all online. You've got big companies like Helium Health now and all this other stuff, but it still doesn't solve that problem of with the IHVN one that we did the following year, where there's 200 clinics. They're offline most of the time. Sometimes they have to take the laptop to go sync somewhere. And those softwares won't work like that. That wouldn't work. And so that kind of stitching OpenMRS together, getting the syncing to work, getting them to work kind of offline, that still was quite unique. And that still, there's probably a niche for that still. Whether or not someone's willing to pay for it now is the complicated part.
Yeah. Well, we'll go into maybe more of that as we go. But, to go back to kind of just the birth of eHealth Africa, of course, it was not eHealth Africa then. It was eHealth Nigeria. And I was going to ask you, so I don't remember when we came up with that name. I kind of remember it was just oh yeah, well, let's just call it eHealth Nigeria. But do you remember an actual story of when it started, we started calling it that?
No, not at all. I mean, I couldn't even pick a real time. It wasn't, it was we started working on it right in that fall Maybe it was like we started working on it closer to the following summer. I actually don't remember.
No, I mean, right when we came back in fall,
Yeah.
we started, because remember, we started that group at the university that was like specifically around, I think, like electronic medical records in healthcare.
Yeah.
And maybe the name didn't come up until we actually had to start doing fundraising.
Yeah.
But
because someone drew that logo as well.
Anna, remember? Her name was Anna.
Yeah.
Yeah, I found it, by the way.
That first logo.
Yeah. And the funny thing is like, I'm going to put some of those like funny things and I'm going to put them in a folder so that we can like have them again, but looking back on it, it's like so terrible. But I just remember at the time being like, this is the best thing ever.
So. Yeah, it's eHealth, but then it's like got a stethoscope for some reason.
It's Africa with a stethoscope around it. Yeah.
Nothing to do with eHealth whatsoever.
No, but all right. Well, we don't know how the name happened necessarily, but I kind of have a feeling there wasn't a lot of thought put into it. It was just, we're doing eHealth in Nigeria, and therefore, hence eHealth Nigeria. All right. So we get back to the university, we're working, and, the only reason I think this is worth bringing up is because, like, I remember at the time it being such a big deal. And I do feel like if this rift between you and our professor at the time, if it hadn't had happened, I'm kind of curious as to, would things have turned out differently? But just to kind of start off, do you remember why this rift happened in the relationship and like what the issue was about and, the general problem between you and him?
It was, the timing is more, I think, coincidental than anything else, but it was very much like I was kind of approaching that point where I was kind of done with work there. And I'd start applying, looking for the kind of exit path. And I'd kind of like I think before we even went on that first trip, with the medical record system, and I told Paul that, this would probably be my last year when I came back, and these are the things I wanted to do. And ever since that happened, it was kind of like, there was a lot of like pressure to be like, oh, we'll just do one more year, do this, do that. And, it was mostly because like the fundraising for the different programs and for that social science division was going well. I mean, every year that I worked there, we were the number one fundraisers in the social sciences. Well, he was, because it was all in his name, so he kept winning these awards and getting these accolades, and I kept making the exact same low salary doing that work. And so I realized it was kind of time to move on. And kind of once I announced that, there was always a lot of like tension. And then when this came back and with kind of eHealth Nigeria, I think he saw also a lot of potential. He saw that there was this kind of social enterprise business there. I think he really just wanted to own it, and it being an independent kind of thing that was going to leave his sphere, like he was kind of like openly hostile about, and weirdly went out of his ways to like really make that difficult. And because I think he was really afraid that we were going to like take fundraising from him, and some of the people that were funding our programs like Packard and like some of these other groups would want to fund us instead of continuing to fund the program. And so I think there was just a lot of tension there. And I think academia they just really thrive on control. They really, with their PhD students and whatever, they really kind of like thrive on controlling their PhD students. And Paul did that with me for 5 years, and control it, really kind of micromanaging like every aspect of my life and making sure that it was like would never get too far from him in that work. So
yeah. I mean, again, I think like I remember it being such a big deal at the time, mostly because I think he was just really vindictive and kind of an asshole. Yeah. And so I remember just being really hurtful at the time. But the reason why I think it's interesting is because I think he was such a jerk. Like it definitely instilled like this kind of like, fuck you, we're going to make this work. We're going to be successful type attitude, where it was like, it gave us even more incentive than we necessarily had before to like jump in with both feet and do it. But I just wonder, like, if that hadn't happened and he had come back and was like really supportive and, wanted to help you to kind of like move into that field and done that, I do really wonder, like, would we still have done what we did, or would we have come back more into the academia side of things?
Yeah, I think that's hard to say. I mean, I think if it was really supportive, it could have been easily like a spinoff that had, maintained a university affiliation. Which, there's lots of research centers that do that, and they spin off so they can kind of maintain their own overhead but have a relationship with the university. And that would have been really easy to do with like internships and funding and all kinds of things. But it was just, with Paul, it was kind of like all or nothing. I mean, he was like financially like screwing with things as well. Remember? He
Oh
was
God, I forgot about that.
yeah, so he would overpay the scholarships and then ask people to give him cash back and like in the field. And, so because like he wasn't very successful at raising his own research funds. And so he's like taking it from the student research funds and he's doing really, really shady things in general. And I think, besides his vindictiveness and which kind of pushed us, sealed the deal, like, the other thing would have been like any money raising besides the overheads, like, he would have been trying to embezzle them just like he was with the other research funds. And so it would have crashed and burned at some point, and probably like wouldn't have been him getting in trouble because he's a tenured professor, probably lead to us getting in trouble for whatever he's doing. So
yeah, no, I mean, I think obviously at the end of the day, it's better that, it happened the way it happened. But sometimes you do kind of look back at like these pivotal points where things could have gone one way or another. And I feel like that was definitely one of them. So then to close out this kind of first conversation, the place that I want to leave it is, we fundraised the money, we're headed back, we're getting ready to be headed back to Nigeria. Do you remember in that time, like, what were your thoughts going back to Nigeria? Like, because obviously we didn't necessarily know that we would now be here for over 10 years, any of this. Like, do you remember before you're getting on that plane, like what your kind of thoughts were? What did you think was going to come out of the next 6 months? Because at that point we had committed to a 6-month period. I had put on hold school for 1 quarter with the intention to come back. Do you remember what your thoughts were at that time?
I don't. Yeah, I mean, I think it was just the 6 months, and then because I think I was even applying for things beyond that 6 months, so I kind of had the idea that do this project and then apply for jobs or other activities like as a follow up to that. But that's, I think, all I really thought. Didn't really have much of a plan outside of that, because I think I still kept paying rents on my apartment or my room, whatever, in Santa Cruz.
Yeah.
At least for a while. I think at least for that 6 months, it was like they held the room for me. So I definitely had to thought, we were going back and I was going to do work. But
yeah, I think I was the same. We definitely went with the intention that it was going to be a 6-month thing and then that we would be coming back. So yeah, it's just kind of funny how that turned into a 6-month project turned into over 10 years now. All right. Well, I think that's kind of it from that first time frame. So next time we will talk about something else.
All right.
Thanks. Thank you for watching this episode of the EHA Founder Series. Please like and subscribe to our YouTube channel so that you can be updated as we continue to post new videos about our journey and about impact investing in Africa.